Good morning students. So today we will be starting with respiratory functions. So under that we will see upper respiratory tract infections. So upper respiratory tract infection include those affecting respiration tract from nose to the larynx. Acute upper respiratory tract infections include common cold, pharyngitis, tonsillitis or acute laryngotracheobronchitis and otitis media. So when we say upper respiratory, usually it affects from the nose to the larynx. That's why we call that to be upper respiratory. So few examples that are given are, which we will be dealing is common cold, pharyngitis, tonsillitis and then otitis media. So when we talk about common cold, it is most common infection in infants and children. Then what are the causes? It is usually caused by viruses like para-influenza virus, adenovirus, influenza virus, respiratory syncytial virus. It is also spread by droplet infection. So every respiratory infection becomes communicable because of the droplet infection. And then predisposing factors, when you see, it is exposure to the cold climate or overcrowding. So that's why we say, right, so even COVID virus is believed to multiply in cold climate, and then we have to prevent overcrowding. Okay, social distancing is done, poor sanitation and malnutrition. So clinical manifestation, you will see that the child will have nasal congestion, sneezing, nasal discharge. So initially watery and may become mucoid or purulent. And then non-productive cough, fever will be manifested. Next you have medical management. So in the medical management we know, so usually symptomatic treatment, according to the symptoms they will be treating. So they will give analgesics and then decongestants will be given and antihistamines will be given. So nursing management, we have to relieve nasal congestion, clean the nares to remove secretions, administer nasal drops as ordered, to relieve cough by steam inhalation and humidification of air, monitor vital signs, administer analgesics and antipyretics, prevent spread of infection to others. So social distancing or wearing a mask, covering yourself while coughing, and so that droplet infection can be prevented. And then provide bed rest until fever reduces. Fever is because of the inflammation, it will come down. And then provide, prevent spread of infection to others. And then offer small and frequent feeds and fluid like water, glucose, juice and other liquids. So usually vitamin C drinks can also be given because it produces immunity. Okay, and early recovery from the common cold. Then change position frequently, observe for complications. Next you have acute pharyngitis, which is also called as sore throat. Okay, so acute pharyngitis is due to acute inflammation of the pharynx and tonsils. So what are the causes? Causative organism include viruses, bacteria, rubella, group A, beta, hemolytic streptococcal irritants, fumes. Okay, so people who are having DNS, deviated nasal septum, usually they are allergic to dust and they are also allergic to smoke. Okay, sometimes they are allergic to perfume. Okay, so these are few common causes of pharyngitis. Then you have acute manifestation, fever, malaise, anorexia, nausea, vomiting, throat pain, headache. Okay, so these are the symptoms: fever, malaise, anorexia, lack of appetite, nausea, vomiting, throat pain, headache. All this you would have studied in medical surgical, it is the same. Okay, management, again you have to give antibiotics such as penicillin or erythromycin is a very good drug of choice for sore throat. Then symptomatic treatment, according to the symptom it has to be treated. Then you have nursing management, so relieve pain with analgesics as prescribed, check temperature, cold application, cold sponge if temperature is more than 103 degree Fahrenheit, or if it is above 100 we can still give, cold compress can be given. Okay, not cold sponge, cold compress can be given. And then provide small frequent liquids and semi-solid fluid, encourage warm saline gargles and hot and cold compress may be applied to neck. Then educate about continuation of antibiotics according to prescription. So these are the various nursing management that has to be provided. Okay, so next we will go into acute laryngotracheobronchitis or CRU. Okay, so we call that to be LTB, acute laryngotracheobronchitis or CRU. So CRU is acute infection of larynx and trachea. So acute laryngotracheobronchitis is most common CRU syndrome, common in children 1 to 3 years. Okay, so mainly you can see with it actually affects, okay, larynx and the trachea, and then it is most common CRU syndrome among the age group of 1 to 3 years. So when you see causes, You have viruses which are like para-influenza virus, and then that is like influenza virus, adenovirus, then RSV. Then you have diphtheria, pertussis and epiglottitis due to streptococci. Okay, so these are the various causes that can lead croup disorder, which is the acute laryngotracheobronchitis, which is common among 1 to 3 years. Then clinical manifestation, you have attacks common at night, barking cough. Their cough will be so severe like the barking. So that's why dry cough. Okay, so that's why we call that to be barking cough. Low grade fever, hoarse voice, because the bronchitis and larynges is affected. Okay, so that's why you will see hoarse voice and thick voice, then inspiratory stridor. So when they inhale, that time you will have stridor, which is the abnormal respiration sound. Okay, which is a shrill vibrating sound. That is the stridor. Then tachypnea, dyspnea, intercostal retraction, respiratory distress, irritable, restless, difficulty in swallowing. So these are the various clinical manifestation. Next you have diagnosis. So when we talk about diagnosis, again physical examination, history collection, physical examination. Then you have blood culture and sensitivity, bronchoscopy, X-ray of neck, then nasopharyngeal culture. Okay, so nasopharynx, from the nasopharynx they will take the swab and they will send that for the culture. Okay, so these are the various tests that is done. Management, you have to provide same all that is required for common cold. Okay, but here if the larynx and the bronchitis is so severe, if it leads to congestion, then the child has to undergo tracheostomy, opening in the trachea to ease breathing. Provide high humidified air and oxygen therapy with low concentration. Keep ready all equipments for tracheostomy. Antibiotics, bacterial infection, viral infection, corticosteroids. So these are the various treatment that is given. Then coming on to nursing management, to monitor respiratory rate, depth, observe for signs of respiratory distress. Then provide humidified atmosphere like steamy bathroom. Give oxygen inhalation. If airway obstruction is present, insert artificial airway. Change position every second hourly. Encourage older child to turn, cough and deep breathe every second hourly. So you have to check the vital signs. Okay, see the signs of any respiratory distress in the child. And then you have to provide humidified atmosphere like steamy bathroom. Okay, so make sure that with the steam, when you send the child, automatically, the child will sweat out the fluid that is there from the sinuses, from the body. Then give oxygen inhalation. If any airway obstruction is there, then we have to insert artificial airway, that is we have to ventilate through ventilator. Then change position every second hourly. We have to encourage the child, older child means we have to cough, provide them cough and deep breathing exercises so that they will be able to cough and deep breathe every second hourly. And then suctioning is required, physiotherapy has to be given, administer antibiotics, corticosteroids as ordered. And then if child is unable to take by mouth, IV fluids can be given in order to prevent dehydration. These are all self-explanatory. Provide clear and high calorie liquids if tolerates orally. Then we have to provide rest. It is not test, it is rest. Then maintain quiet and restful environment. Encourage the child and parents to express and ventilate their feelings. Explain parents about child condition, treatment and reassure them. Okay, so these are the various nursing care that is involved for croup or acute laryngotracheobronchitis. So here laryngitis, larynx is involved, trachea is involved and bronchus, okay, bronchitis, okay, inflammation of the bronchi. So all three conditions are involved. So that condition is called as croup disease, okay. So next we will go on to asthma. We'll see it in the next video.